Following the decision by the United States to freeze funding to the health sector across the globe, Kenya is expected to lose $30.9 billion in funding from the Donald Trump-led administration. The effects of the stop work order is likely to be felt more by HIV, tuberculosis and malaria patients. According to Health CS Deborah Mulongo, the freezing of donor funding to the sector will have severe ramifications. Among the likely repercussions include a likelihood of at least 58,000 new HIV infections by 2030, with a further 23,000 tuberculosis-related deaths expected, 20,000 of which are those suffering from HIV. Mulongo also noted that the cut in funding is likely to see at least 12,000 malaria-related deaths annually.
I saw some people the other day crying, oh, I don't know, Trump has removed money. He said he's not giving us any more money. Watu wanalia. Why are you crying? It's not your government, it's not your country. Yeah. No. He has no reason to give you anything. I mean, hey, you don't pay taxes in America. He is appealing to his people. Shauri yenu bana. This is a wake-up call for you to say, okay, what are we going to do to help ourselves? Instead of crying, tujiulize, what are we going to do? Haya ametoa hiyo pesa, sasa tutafanya namna gani jameni? What are we going to do? Yeah? To support ourselves. Because nobody is going to continue holding out a hand there to give you. It is time for us to use our resources for the right things. We are the ones who are using them for the wrong things.
Bunge, ladies and gentlemen, welcome back to BAV. This is Bunge Audio Visual. Yeah. So today we are going to talk about the critical issue that could affect the health and the well-being of the Kenyans, and not just today, but well into the future. So our country, Kenya, is actually facing an alarming challenge, a potential surge in the new HIV infections and the loss of crucial funding for the vital health programs. And I think in this episode, we'll just have to do some sort of breakdown. We're just going to break down the implications of this funding cut and why it's important for us to come together, and what we can do to mitigate the long-term impacts of the cuts of the funding from the US after President Donald Trump alikuwa sworn into office. So there is a post come across, ilikuwa inasema the health ministry says cuts to HIV programs could result in 60,000 new infections by 2030. Na pia walikuwa wanasema Kenya imekuwa ina face a potential increase of around 60,000 new HIV infections by potential increase of around 60,000 new HIV infections by 2030 due to the halt in funding from the United States Agency for International Development, that is USAID, creating a funding shortfall of about 30.9 billion each year. The Ministry of Health and the Council of Governors apparently zimesema zitakuwa na yeah, and so those are some of the issues that we're going to experience. And I think in the other post pia yenye ilikuwa nimeona ilikuwa inasema the health ministry pia as I've said, it estimate 58,000 HIV cases, 12,000 are being malaria related deaths, and annually 23,000 TB-related deaths by 2030, following the $30.9 billion donor funding cut by Donald Trump. So, we have also seen the other video of former President Uhuru Muigai Kenyatta. Pia alikuwa anasema, why are we crying and it's not your government? He isn't your country. It isn't your country and has no reason to give you anything that you're crying for. So, he also said that you guys are not paying taxes in America, and that Donald Trump in his speech was trying to appeal to his people. And they should actually take this opportunity, or rather this crisis, as a wake-up call, so that they can be able to do, or rather ask they can be able to look for solutions, or ask themselves what they're going to do to support themselves as a country. Because personally, I think kumekuanga na history ya sisi kutegemea wazungu sana, or rather our colonial masters, in terms of funding. Kila kitu nataka donation, kila kitu nataka funding. That's why the United Nations imekuanga ikikuwa all over in the country. You've got to Kakuma, kuna kwa refugee camps. You get to where siju kuna kwa nini za peacekeeping. Kunaenda wapi? They have got so many agencies zenye zinakuja tu kusaidia Africa in the name of donation or rather in the name of funding. At times they give you what you call the grants. I don't know where these grants come from. Yet our own selves tuko na country na iko na resources and we can be able to exploit our resources. We've got people who have got been what we've got people who have gone to school. They've got they've gathered adequate knowledge. They've gone through various forms of training or let me say various levels of training to ensure that they can be able to work at their best, the level best in depending with the kind of field they've chosen to pursue. So this is actually a wake up call to most Kenyans. Na pia nitasema pia we've got various state agencies in Kenya, state corporations in Kenya. We've got KEMRI, that is the Kenya Medical Research Institute. Kazi yake ni kuresearch about madawa zinaenda kutumika kusaidia watu in case you get some challenges huko mbele zenye ziko related to what has to do with the health. Then pia apart from KEMRI tuko na pia na KEMSA, that is the Kenya Medical Supply Authority. The funny thing is that these set organizations, as if there is no invention yenye zinaweza sema zimefanya since the day they were established in this country. Hakuna inventions zenye zimefanya zenye zinaweza better lives za wananchi, or rather zenye zinaweza reduce the chances of being struck by a pandemic or an endemic at any given time in this country. So that's why mliona time ya COVID tulikuwa tuna rely on the vaccines from abroad. So we had to operate under their mercy, because there was nothing that we could do as a country to ensure that some of the affected citizens are actually going to survive amid the pandemic. So let us get back to the main discussion. So at the moment, Kenya, which is the home to the 7th largest HIV burden in the world, imekuwa ikimake significant strides in combating HIV, and we've achieved remarkable results meeting with the key United Nations aids, and we've got various targets that tumekuwa able to achieve. For example, we've got the target, the 96% awareness target, we've got the 98% treatment access, and the 97% viral suppression among those living with HIV. So the accomplishments that have these kind of accomplishments zimekuwa able to drive largely by international zimekuwa able kuwa driven largely na international support, including the significant funding from the United States Agency. Hiyo nimekuwa naongelea the United States Agency for International Development, that is USAID. However, this support is now at risk because USAID, which has been a crucial partner in financing HIV and tuberculosis na malaria programs, imefanya funding yake imekuwa put to a halt. This means that creates funding shortfall of about 30.9 billion every year, and funds that are desperately needed for HIV prevention, treatment na vital health supplies na technologies zimekuwa cut short, meaning most of the guys are actually depending on them watakufa. Some of the people wenye wamekuwa live with HIV and AIDS actually going to right now their life is at stake. So it depends with how fast you are going to respond to this issue, rather this crisis, because tukizubaa pia it means that kutakuwa na so many death tolls ya HIV related infection by 2030 vile mapatiana hizo figures. So how urgent is this situation, and how are we going to navigate, or rather how are we going to resolve this issue ya kucut short hizo donations from the United States? So talking about the urgency of the situation, I won't say we need to look for a different partner to get funding from. But what I can say is that this is not just statistics or numbers. It's about people and real lives that are going to be affected. And that health officials are already warning that in the absence of the adequate funding, the number of preventable deaths from diseases like the TB and malaria and HIV. In fact, the Ministry of Health imepeana hiyo figures that around 23,000 people could die annually from tuberculosis alone. Achana tena HIV, tuberculosis alone, 23,000 people watakuwa nakufa annually by getting infected with the TB. Then many of the people living with HIV AIDS, because of the lack of treatment and intervention, pia wanaenda kudedi. You know, HIV takes inakuwa na various stages, so it's going to take some time, but eventually most of the people are going to succumb to it as compared to the time that we used to receive funding as a country. And another question you need to ask yourself is, what can we do? The same way the president said that this is actually a wake-up call, that we need to seek for a solution. We need to find a way that we as a country can be able to depend on ourselves and ensure that we actually sustain the citizens living in this particular in the bounds of Kenya. So as a country, I think this is a moment for us to actually reflect on how we can come together to address these challenges. While the international funding has been critical in the past, we also must look inward, and it's time to ask ourselves how we can better and support our health systems and ensure that access to treatment and take responsibility in preventing the spread of the diseases like HIV and tuberculosis. Then we also need to, since we cannot afford to wait for external support indefinitely, the same way the president has said, you cannot expect somebody to be helping you over and over and over again, but in turn you've got nothing to give. So it means that hakuna mkate mgumu kwa chai, and it's time for more investment in local solutions, such as strengthening our public health infrastructure, enhancing local production of medicines and medical supplies, and increasing the public awareness and community-based health programs zinakuwa put into practice. Then the Kenyan people, since they've already demonstrated immense resilience in the face of adversity, now it's time for us to be proactive, adaptable, and also innovative in a way that we're actually addressing this crisis. Because I'm pretty sure, if given a chance, I think we've got people who have got the potential to actually come up with a very, very good solution as far as the health of this country is concerned. Then what is the call to action in such a case? So, and what I can say is that in this particular moment, this moment actually serves as a reminder of how fragile progress can be, and that we shouldn't wait until the situation worsens. Together we must advocate for better healthcare. I would also demand more accountability from our government and support what do we call now, more than ever. It's also essential for each of us to play a role in the health of our nation, whether it's by getting tested for HIV, supporting those living with the virus, or simply spreading awareness about the prevention. And I think every action counts. But at the end of the day, let us try as much as we can as a country to jaribu kuweka vitu mbele, because we must act swiftly and with unity and resolve, because the health of the nation entirely depends on it. So let us think about the future, and let's ensure that Kenya remains on the path to health, progress, prosperity, and for all. So for that, I'll just say that the end of today's episode. If you kama kuna opinions ulitaka kushare, like kuna comment section iko hapo chini. Thank you for tuning in to today's episode. Let's continue to stay informed, stay committed, and most importantly, stay hopeful. So what I can also say that the challenges we face are great, but so too is our collective strength, and together we can navigate through this moment and come out stronger on the other side. So stay safe, take care, and let's keep the conversation going.